Hi everyone! I'm going to bring to you a very different kind of video today, and it has to do with current world events, which I know can be a triggering topic on so many levels, especially for those of us who have it, the kind of injury that we do. And my intention is not to create any sort of contention or any sort of, to trigger anybody in any way with this, although it's kind of inevitable when you're talking about sensitive topics. But what I am doing here is I'm trying to give you some perspective and some hope to know that you're not alone and to know that you do have more power than you think you do. But because of conditions on social media and such, I have to be very careful about the words I use. So I am going to be talking about the plague, and I will be talking about the pharmaceutical industry's cocktails that they have been putting out on the market to counteract this plague. So please understand, those are code words, not because I'm trying to be dishonest. In fact, everything that I'm going to be saying today is going to be backed up by credible sources. I have links for every statement that I'm going to be making, that you can go to benzobrains.com and you can follow that link and look at that source, because I feel it's really important that I back up this narrative with that kind of information. So I'm going to actually just mainly be reading to you from this write-up and showing you some images and things like that. So just kind of sit back, relax, and as much as you can, and take this in, and I hope you find it helpful. Hulu's Dopesick and the Pharma pandemic profit pattern. If you have an iatrogenic injury and you haven't seen Dopesick yet, I highly recommend it. But make sure the kiddos are out of the room, as a couple of characters dish out the F word like it's candy. Seeing A-list actors like Michael Keaton call out Big Pharma for following the same nefarious playbook and rolling out OxyContin as it did Xanax and other psych meds is truly cathartic, as well as infuriating. What was really disturbing, though, was to realize that the exact same pattern had been followed throughout the evolution of the current pandemic. I know that for some of you, I'm a bit behind the times here with this message, but my goal here isn't just to flood you with a bunch of frustrating facts and then send you off to argue it out with your Facebook friends. My hope is that with some perspective, you will see how there just might be a way out of this mess. And it starts with acknowledging that the sky is blue when so many powerful and influential institutions want you to believe it's green. Let me start off by saying this is not a commentary on the effectiveness of government protocols, cocktails, or the severity of the plague virus itself. This is me providing you with information to help you awaken to your situation and discover the freedom you have to choose another path if you so desire. I have no opinions on what you should and shouldn't put into your body. I have no judgments for any dependence you might currently have on pharmaceuticals. Heaven knows, since my son caught the plague last month, he has started on 5 medications just to literally keep him from starving to death because of how it has affected his autoimmune illness. So please believe me when I say I have only compassion for you, whatever your situation. Ultimately, my goal is and always has been to educate others in an effort to help prevent as much pain and suffering as possible. Okay, now that I'm finished with the disclaimer portion of this video, let's move on to discuss how fantastically Dopesick exposes the devious and dishonest business model of the pharmaceutical industry. But warning, if you're not already familiar with the history of Purdue and the opioid crisis, there are some spoilers ahead. There are 9 steps that I have discovered in this pharma business playbook plan. Number 1, the old drugs aren't making new profits. I mean, they're making profits, they're just not making a crazy ton. In episode 1 of Dopesick, it introduces us to the Sackler family who run Purdue Pharmaceuticals. Due to its highly addictive nature and questionable long-term benefits, the old opiate, MS-Contin, basically along with every other opiate on the market, is only approved for emergency use and cancer treatment. But no decent doctor would prescribe it regularly. So the solution is simple. Develop a new version of oxycodone that can be prescribed to everyone all the time. Does this sound familiar to you? When it comes to tranquilizers, the old, highly addictive barbiturates are also highly regulated and cautiously used, for the most part. And the original benzodiazepine, Librium, just wasn't widely used. But never fear, in 1963, Mother's Little Helper will solve this problem. But what about the pharmaceutical industry, specifically when it comes to cocktails? In 2017, the little-known biotech company, Moderna, said their focus on was losing profits, apparently creating mRNA cocktails for things like cancer, really rare diseases, and the flu is a, quote, loss leader. Mainly because they have way too many dangerous side effects. But Moderna says they do have a secret cocktail they are working on that they feel will help turn a profit. In fact, in 2016, one of their reps said, "We think that when the world does get to see Moderna, they're going to see something far larger in its scope than anybody's seen before." Step number 2, create a new drug for a new illness. In 1966, Purdue releases the, quote, safer opiate called OxyContin to treat what is coined as chronic moderate pain. They also educate doctors on how to diagnose and treat what they term as the 5th vital sign, pain. The new, highly subjective 5th vital sign is now strictly monitored in hospitals, along with blood pressure, respiration, pulse, and body temperature. And at this point, the Sacklers take OxyContin from a $48 million drug to $1.1 billion. But wait, there's more. Flashback to 1963, benzodiazepines receive a much more lenient drug classification than the Schedule II opiates and barbiturates. With a Schedule IV classification, tranquilizers can now be prescribed daily. Hoffman LaRoche's new drug Valium is marketed to treat what they term psychic tension. You're going to see a lot of quotes in there, quotes from me or quotes in my blog. Anyway, it's not long before Valium becomes the first pharmaceutical in history to reach $1 billion in sales. Eventually, benzodiazepines and antidepressants are used in combination to treat the newly discovered cause of psychic tension, the chemical imbalance. Spoiler alert, it's the pharmaceutical industry that comes up with the whole idea of chemical imbalance, and there's actually no such thing, and they're never able to prove it. Moving on. In a rather fortuitous turn of events, 3 years after Moderna fails to live up to its billion-dollar evaluation, and other pharmaceutical companies are losing profits on their top sellers, the plague officially hits worldwide. By the next year, Pfizer makes $34 billion from plague cocktails. That's $93.5 million a day, shattering any previous record for any pharmaceutical in history. And meanwhile, Moderna projects 17 to 22 billion this year from its plague cocktails. Step number 3, get TENUOUS FDA approval. Purdue supposedly convinces the FDA employee reviewing their drug that OxyContin is less addictive because of its delayed release, longer acting mechanism. Pay attention to that. That same employee ends up working for Purdue soon after. This isn't surprising since 1 in 4 FDA employees ends up working for the pharmaceutical companies they regulate, where they are offered much larger salaries. Alternatively, when Xanax comes on the market, it is touted as a safer benzodiazepine than Valium because of its shorter half-life. And until the 2020 black box warning, the FDA ignored patient reports and petitions from medical professionals and patients regarding the adverse effects of and misleading warning labels for benzodiazepines for over 50 years. Their response to one official petition uses the circuitous logic that psychiatrists use benzodiazepines to treat anxiety, which is long-term. Therefore, benzodiazepines are safe to use long-term. In 2021, the new Pfizer, Moderna, and Johnson & Johnson plague cocktails receive unprecedented emergency use authorization from the FDA, and the booster cocktails eventually received the same TENUOUS approval. So they didn't even get the same kind of approval that OxyContin and Xanax got. Okay, number 4. Dishonestly and aggressively market new drug to the physician. Here you have the pain assessment tool. You've probably all seen this at this point, but did you know that this chart was actually developed by Purdue to encourage doctors to prescribe more painkillers? Congratulations, you have all been subjected to pharmaceutical industry advertising. In Dopesick, we see doctors at pharmaceutical conventions showing graphs of patient blood levels on OxyContin, which suggest that it has smaller peaks and valleys compared to other opiates due to its delayed release coating. Eventually, we discover Purdue manipulated the charts to make them look like that, and the FDA was even aware of it. In reality, there is no difference between OxyContin and every other opiate. We also see Purdue threatening to sue doctors and pharmacists if they refuse to prescribe or dispense their drug. What's more, medical schools, alongside Purdue reps, teach doctors that only 1% of patients become addicted to opiates. But the research they're citing is totally bogus. Watch the show to find out more. But misinformation is a powerful tool, as we all know. And the Sacklers eventually make more than $10 billion off of OxyContin. When Xanax hits the market in 1981, Pfizer enlists expert physicians to educate doctors about their studies, which show patients taking Xanax have remarkable improvement with panic attacks at 4 weeks. What they failed to show doctors is how at 8 weeks, the subjects on Xanax had far worse outcomes than those on placebo. What's worse, they fudged the data by using Valium to curb the severe withdrawal effects that patients experience coming off of Xanax. And thank you to Robert Whitaker for that research, which I'm quoting him here really. So how does this pattern play out with the plague? Well, for one, information presented to the UK Parliament in 2021 from one of the world's most prestigious medical journals, the BMJ, written by some of the world's most trusted, unbiased medical researchers and physicians. One of those researchers is somebody that I believe has probably literally saved thousands, if not tens of thousands of lives, and that's Peter Goethe, who used to work with the Cochrane Foundation, an independent research facility. So they tell Parliament that current data does not support mandatory cocktails. This is censored. This information is censored worldwide on social media. You can't post it and you can't read it. In the US, physicians throughout the country are reprimanded and publicly shamed for criticizing these same mandates and promoting alternative treatments to cocktails. Again, follow the links in my blog. And 80 public health officers and medical researchers from all over the world have to sue the FDA just to obtain Pfizer's cocktail trial data. And honestly, considering that half of all trials are buried anyway by the pharmaceutical industry, what the FDA does have is likely only a fraction of what the real trial data shows. Step number 5, vilify the old drug. Pharmaceutical reps in Hulu's Dopesick are shown just constantly repeating to doctors over and over again, Vicodin's bad for your liver. Don't give Vicodin, give OxyContin. And after gaining notoriety through Betty Ford's public experience and the Rolling Stones song, Valium is now the bad benzo. But that's okay. We have Xanax, right? Even though Xanax proves to be far more addictive. As prescriptions for diazepam in 2013 sank to 14.8 million in sales, alprazolam, generic for Xanax, reaches 48.8 million prescriptions. Are you seeing how it's really just all about the money? In an unprecedented move, Merck publicly discredits its own drug that begins with an I, and some people use it to treat the plague, while simultaneously rolling out the world's first plague pill, all in the same year. In another rare, almost unprecedented event, the prestigious Lancet medical journal retracts discredited research it published showing the H drug, I don't know if I want to say that one either, harms plague patients, but it's too late. That research was faulty, it was false, it was totally bogus, but this just continues to be quoted by journals and news sources worldwide, even though they retracted it. Number 6, label adverse effects and drug inadequacy as a new illness requiring more drugs. Ever heard of breakthrough pain? It was the new term the Sacklers developed for people who were experiencing pain a few hours after taking OxyContin despite its supposed 12-hour time-release coating. How were doctors instructed to treat the breakthrough pain? Prescribe higher doses of OxyContin. Not more frequent doses, just bigger pills. And if you've ever heard of bipolar 2, that is an illness that is literally only diagnosed when someone has an adverse reaction to an SSRI antidepressant. And of course, if someone is experiencing worsening anxiety, pain, insomnia, or whatever on antidepressants or antipsychotics, bipolar meds, benzodiazepines, then, well, that's just a manifestation of their underlying illness. And the solution, of course, is more drugs. And with regard to current world events, well, this is current, but you know what I mean. As claims by Pfizer and AstraZeneca that their plague cocktails are 95 to 100% effective prove to be woefully misleading. I mean, they just totally misrepresented one set of data and another set of data. Again, look at my blog and the links. The public is informed that regular booster shots will be required indeterminately to maintain immunity. Meanwhile, mRNA, do I want to say that? Cocktails are completely ineffective at preventing infection and spread of new variants. Yes, this is understood. It's there. Okay, moving on to number 7. We're almost there. Deny and patient blame for continuing adverse effects. Purdue spokesman in Dopesick repeatedly blame addicts for their illicit behavior for ruining it for everybody else who legitimately needs these meds, even though post-mortem studies reveal that the majority of people dying from OxyContin are actually taking it as prescribed. And just, I'm going to throw this in here, over at least half of prescribed OxyContin overdose deaths also involved benzodiazepines. Speaking of which, if you have a hard time taking or getting off of Xanax, Klonopin, Ativan, Valium, you're likely to be labeled an addict, even if you're not abusing the drug. Do you see how this blame game works? And those who speak out about the dangers of psych meds in general are repeatedly told by the psychiatric industry, NAMI, to stop pill shaming those who need them. Also, in an astounding turnabout, patients are now gaslighted and told that the chemical imbalance theory is an urban myth, and their doctors never actually told them they had one. But all you have to do is go onto any mental health support site and you will see patients constantly talking about how it's like diabetes. You would take, if you were missing that ability to break down sugar, you would put that chemical into your body, wouldn't you? Well, it's the same thing with psych meds, except it's not the same thing as psych meds. So did those patients just come up with that on their own? And as for the plague blame game, let's just keep this one simple. It's the fault of the uncocktailed, the unmasked, and Joe Rogan. Number 8. After lawsuits and years of dismissed patient reports, the FDA backtracks and revises warning labels. So OxyContin finally receives a black box warning in 2001. Eventually, opiates and benzos receive sort of like this dual black box, not to prescribe those together because that'll kill people too. Lawsuits ensue, but history shows that despite payouts, drug companies actually make even more sales and more money post-litigation. After all, what's $3 to $4 billion in payout when you're making 10 times that much just in 1 year from one new drug? And after almost 60 years on the market, a public citizen campaign, and a Lisa Ling expose, benzodiazepines finally get a black box warning in 2020. Unfortunately, black box warnings do not generally affect the prescribing practices of medical practitioners. And in 2020, benzodiazepine prescribing actually increases. And it's still early in the game, but data integrity issues have already emerged about some of the plague cocktail trials. And given that from 1991 to 2015, the pharmaceutical industry paid out $35.7 billion in fraud, and I'm sure quite a lot more since then, for its FDA-approved products, it wouldn't really be out of character for new information to emerge during litigation regarding these cocktails sometime in the future. Number 9, the pharmaceutical industry provides the cures for the problems it creates. Are you addicted to opiates? You're not alone. The market for the drug treatment for opiate addiction, methadone, has increased during the pandemic. And Pfizer seems to be determined to make enormous profits off the effects of the pandemic on the vulnerable as well, with its product, naloxone. That's a good one to read. They're charging people through the nose for that one, pun intended. But has this whole pandemic thing made you anxious and depressed? Again, not alone. Prescriptions for tranquilizers spiked 34% in 2020. This is a sharp about face from the 12.1% decline in Xanax and Valium prescriptions in 2015 and 2019. Not to mention the global antidepressant market skyrocketed to $26.25 billion. So apparently, the plague is really good for the drug industry, if not so great for your personal health. And finally, are you worried about catching? Never fear. The FDA has now issued 2 new emergency use authorizations for the new pills from Merck and Pfizer. Given that the Wuhan lab leak theory continues to gain credibility in every major news source, it's more than a little ironic that the name of the disease is included alongside the cure by the company that created it. And by it, I mean the plague pill. And here we have the side effects of said pill with its emergency use authorization. That looks promising. So what now? Well, in some ways, given that the pharmaceutical industry is one of the most powerful entities on earth, it may feel like we need some kind of divine intervention at this point. And while that may be true, it is also true that the only reason these companies have any power at all is because we give it to them. I mean, think about it. If everybody stopped buying drugs today, they would lose all their power. And I know, I get it. I realize that's not like realistic for everyone right now. But I work every day with people who were told they had to take this drug for the rest of their lives, and who honestly thought that they would rather die than stop taking their meds. And yet every day I see these same people break free from the system that they were trapped in just a few years ago, or maybe throughout most of their lives. It is possible. And it's also really hard. And while that might require a complete paradigm shift, usually that only starts with just one small step. Look, at the end of the day, you get to decide where you want to go from here. I'm just pulling on one thread of this intricate web to show you that there really is a pattern. It does exist. The sky is blue, and it's getting bigger and bigger. For me, the pandemic is just next level big pharma tactics. And I'm telling you, unless something happens to alter the design, we will continue to see them take it to the next level and the next until, I mean, you've read the dystopic novels and seen all those movies. I don't have to really paint that picture for you. But what I want to ask you is, what kind of a future do you want? What is it going to take for you? Maybe it'll be like me, a couple of years of quite frankly, torture to extricate yourself from that system. But maybe all it requires is acknowledging that we all need to start placing more faith and trust in a higher power. A power higher even than the pharmaceutical industry and the governments they lobby and the medical field that they so radically influence. And maybe it means listening more and more each day to that inner wisdom that tells us the way we're living is what's making us sick, and more of the same isn't the cure. Okay, the akathisia pill that they put out on the market to treat the akathisia that their drugs cause, the movement disorder that psych meds create, that's not the cure. The cure is recognizing what the cause is and addressing the root cause. And maybe all of that will require some sacrifice. Maybe a lot of sacrifice. And maybe, just maybe, that'll be worth it.